domestic disturbance. Moore's Grand Hotel. Hear that, Prevention? Moore's Grand. 2 blocks from Feynman's.
Okay, folks, so we will go ahead and get started. For those of you who I don't know, my name is Esley Caldwell, and I'm an acupuncturist with Caldwell Family Wellness. And we're going to be speaking with you today about integrative oncology care with acupuncture and Chinese medicine. If you have questions, feel free to put them in the chat as we're going along. And then we'll have some more time for you to actually ask questions toward the end of the presentation. But while we're going through the slides and whatnot of this topic, please keep your microphones muted so we don't have any background noise coming in. We'll begin with a disclaimer that this presentation is for informational purposes only. So please consult with your healthcare provider before beginning any sort of wellness program. We just emphasize that. So in the title of the presentation, we use the term integrative oncology care. So integrative medicine is sort of a new catchphrase for basically the combination of Western allopathic medicine, i.e. your MD, combining what they offer with folks like myself, with acupuncture or with chiropractic or with nutrition, but there's a combination. So we're taking the best of both worlds. That is integrative care. So we're not necessarily in this presentation going to be talking about alternative treatments for cancer. We're going to be talking about how acupuncture and Chinese medicine work in tandem, in combination, in partnership with Western medicine in treating cancer. So we'll explain more about that. There are some other information that we're going to share about medicinal mushrooms that may have a lot of potential benefit for folks who have cancer now. And so we'll get into that as well. The beginning of the presentation, we're going to talk a little bit about acupuncture and Chinese medicine broadly, and then we'll get specifically into how acupuncture can help with oncology. So first of all, defining acupuncture. What is acupuncture? We all know that there are those acupuncture pins, and I always got some laying around, so we'll pull one out and hold it up so you get an idea of what we're talking about. And we'll talk more about the size of them later. This is an acupuncture pin, if you can see that. I'm holding the handle, and then there's the actual pin part. And notice that I'm not saying needle, and we'll get into that a little more later. That said, the definition of acupuncture: the insertion of these small pins into points in the body to promote healing and the elimination of disease by balancing the electromagnetic energy of your body and allow the body to regain homeostasis and equilibrium. In a nutshell, acupuncture facilitates self-healing. Your body has an amazing innate ability to heal itself, and that is what we facilitate with acupuncture, with herbal medicine, all the different theories and modalities within Chinese medicine. Traditional Chinese medicine, which is one of the oldest continually practiced forms of healing in the world today, going back, depending on who you ask, excuse me, going back, thousands of years. And so oldest continually practiced form of healing. And it's all based upon the facilitation of the self-healing ability of your body. There are 5 principal branches of traditional Chinese medicine, also called TCM. Obviously, we're talking about acupuncture, but also herbal medicine, food therapy, Qi, which is therapeutic massage, and Qigong, which is therapeutic exercise like Tai Chi. These are the 5 branches of TCM. So in the world today, TCM is a complete form of healing, providing primary as well as specialty care. In China, their hospitals there have both systems. You've got Western medicine and Eastern medicine integrated, providing the best of both worlds, the best options for their patients. Now, here in the United States, most major hospital networks have some form of integrative health, but especially when we're talking about oncology programs, whether it's Cleveland Clinic or MD Anderson down in Texas, or Johns Hopkins or Mount Sinai, all of these, the quote unquote premier oncology centers in the country all have acupuncture that's part of their system. And actually here in Cincinnati, at the University of Cincinnati, there is, I believe, an oncology acupuncture component to their oncology program. So how does acupuncture work from a quote unquote scientific standpoint? Now, from the standpoint of Chinese medicine with acupuncture, the way it works is we have an energy in the body that we call Qi. And from the scientific standpoint, we would call that Qi electromagnetic energy. And it flows in pathways. You can see in this image here some of those pathways. These energy pathways are separate and distinct from other pathways in the body. Where you think of your blood vessels or your nerves or your lymph, the acupuncture pathways, the acupuncture meridians are separate and distinct. They can influence other pathways and they have their own pathways. So in a nutshell, the way the acupuncture works is to help to balance and harmonize the flow of energy through those pathways so that there is not obstruction. And if you think of, if you've ever watched water flowing through a river, sometimes you look out in the river and there's things floating that are creating an obstruction, and you see the water kind of eddying and flowing around it, or getting backed up if the water is actually blocked. In our body, when energy is blocked or not flowing properly, that's when we have a variety of symptoms from pain or headaches or digestive issues. And so the role of acupuncture is to facilitate the smooth flow of the energy in the body, flowing smoothly without obstruction, unimpeded. So there are a few different theories as to how acupuncture works in terms of, we know that it is doing something. It's been around for a long time, but science has to catch up. So from the standpoint of catching up with what the sort of old knowledge has been about how a lot of things in the world work, science is catching up and starting to figure things out. So one of the earliest theories about how acupuncture works was the endorphin theory, that basically the endorphins, the feel-good hormones, that when you are working out, you get your heart rate up and you feel kind of energized and that sense of well-being, those are the endorphins. And so one of the earliest theories about how acupuncture works was that the stimulation of those endorphins would help to mitigate the pain perception in the body. That was one of the earliest theories. This theory still has some prevalence. Other theories about how acupuncture works. What they've discovered is that there are temperature changes in the body from an acupuncture point to a non-point. There is a measurable temperature variation, 0.1 to 0.2 degrees Fahrenheit warmer on an acupuncture point. So there is something that you can measure on an acupuncture point and compare it to a non-point, and there is a difference. So the temperature is warmer on acupuncture points. And also there's this concept of galvanic skin response. So when we talk about electromagnetic energy in the body, it's within us, it's our life force, it's what gives us life. And that electrical energy of the body is We know from the heart, on the brain, there is measurable electrical activity. That's your EKG, the EEGs, the heart scans, the brain scans that are measuring that activity. The skin also has an electrical potential that can be measured. And that measuring of the electromagnetic energy on the skin is called the galvanic skin response. And so lower resistance equals greater electrical conductivity. So when there's lower resistance, the electrical current can flow faster. And what they found is that acupuncture points are areas in the body that have a lower resistance. So acupuncture points have a greater conductivity to electricity. So our electrical system is really primed around these acupuncture points. So there are a number of different things that acupuncture can treat, and we're going to talk a little bit about some of them briefly, although the main sort of emphasis of this presentation is oncology. And according to the World Health Organization, also the National Institute of Health, there are over 30 different conditions that acupuncture can treat. That said, clinical evidence and experience of practitioners, we've found that there are many other things that, although the research hasn't caught up with it yet, there are other things that acupuncture can help. So one of the most common things people seek acupuncture for is musculoskeletal pain. So whether it's chronic pain, long-term pain, whether it's arthritis pain, or it's an acute pain from a fall, from sports injury, car accident, we treat pain. And that can be in any part of the body, joint pain, knee pain, shoulder, neck, back, ankle. We treat pain all over. And these are just some of the examples of the types of pain that we treat. And so when it comes to, and actually when we get into cancer, cancer can be, there is pain associated with cancer very often. And so we can help with that too. So for musculoskeletal pain, where you have knots in the muscles and the muscles are very tight, acupuncture can help to release those tight and shortening spasm muscles back into a resting state. We mentioned the release of endorphins to mitigate the perception of pain. And then actually the insertion of pins promotes increased localized healing activity. So just put acupuncture pins in the body helps to encourage again, that self-healing principle, that stimulation there helps to draw blood flow and other cells to stimulate healing to happen in that area where the points have been inserted. And more recently, there have been brain MRIs, functional MRIs of the brain that show deactivation of the centers of pain perception. So acupuncture has been shown to actually shut down the parts of the brain associated with pain. So kind of turning them off, flicking the switch so that folks feel less pain. So when it comes to oncology, the sort of general principle that we have is that we treat the body while the allopathic medicine, the MDs, treat the cancer. And acupuncture has been shown to be very effective for mitigation of the side effects of the sort of conventional oncology treatments. You know, they're very, some of the treatments are very intense, very hard to endure because the side effects of chemotherapy and radiation and some of the medications are very severe. And acupuncture can help to mitigate the side effects so that it's easier for folks to get through the treatment and not feel terrible. So some of the things that we treat when it comes to oncology, nausea and vomiting. This is very common for chemo and also in some cases for radiation. So nausea and vomiting can be improved with acupuncture. Cancer pain and post-surgical pain are also things that can respond. Neuropathy is a very common side effect where you get nerve damage in the extremities. So sometimes folks, in the feet, also sometimes in the hands, the chemotherapy drugs just kind of are very hard on the nervous system. And so folks can lose can have numbness or pain in their fingers and especially in their toes. And so we can help with that. And other common side effects include fatigue and hot flashes, anxiety and insomnia, and then palliative care, which is just helping people to feel more comfortable. So even in kind of late stage cancer treatment, when someone's in hospice, acupuncture can help them just to feel better, be more comfortable. And there can be quality of life improvements as well. And we talked a little bit about the Chinese medicine, TCM philosophy with oncology, and also the flow of energy through the body. But understanding from our perspective in TCM, some of the causative factors for cancer, and stagnation is one of those. So when we look at this slide of the water, we want the flow of energy in our body to be smooth and unimpeded. Okay, in this instance, there are some areas in the front of the picture where it's flowing pretty good, but in the back you can see the rocks, the boulders there that are kind of messing with the flow. And stagnation is when the energy gets stagnant, it gets blocked, and there's a sort of buildup of pressure, and that stagnation can lead to heat, toxic heat and inflammation, and that stagnation can also lead to what we call dampness, which is sort of a sort of fluid kind of stuckness. And dampness, it manifests as accumulation of fat, as obesity, lumps, masses. That is what we would call dampness. And when you combine dampness with heat, you get what we call phlegm stagnation, which is a more stickier situation, literally, which can take the form of nodules and tumors. And that's kind of one of the ways that we look at how cancer can develop in the body. In addition, we talk about stagnation. The opposite of stagnation is deficiency. So when there's not enough energy, when there's not enough water flowing through the energy currents in our body, then we have problems, because our immune system needs to have enough vitality, it needs to have enough juice to do the normal immune process for cancer. Let me just step back. There's always cancer happening in our body. Okay, cancer is normal. There's a normal process where there are disease cells in the body. And the problem when things become quote unquote cancer is when those disease cancerous cells accumulate in significant numbers to cause a degradation of the normal functioning of the body, and they kind of have their own sort of, they've carved out a space where they're doing their own thing. They're not on the program with the rest of the body. But there is cancer happening in everyone's body, to some minute extent. And what typically is supposed to happen is that the immune system sees those cancerous cells, targets them, removes them, and allows the body to have an ongoing process of healing and regeneration. And so when there is deficiency, the immune system is weaker, it doesn't have enough juice to do that job, its normal job of removing these abnormal cells. So that's an issue. And then resilience. This is one of the benefits of acupuncture, is to develop resilience. And when we improve the overall quality of our energy, of our life force, we can improve the innate cancer fighting capacity of our body. Again, our body has an innate ability to fight cancer, and we just have to support that. So again, going back to what we said at the very, very beginning, facilitating self-healing. That's a real core aspect of what we're doing with Chinese medicine. So in terms of cancer prevention, and honestly, even for cancer treatment, just a couple things. I've talked about some of these and other talks that we've given about longevity and about detox. So those talks, I think, are also available on our website or YouTube channel. So we won't get too in depth with these. Having said that, we've talked about intermittent fasting, and again, briefly, intermittent fasting is I just read this today, is the hottest diet lifestyle trend that is going on right now for a very good reason. Number one, intermittent fasting is free. You don't have to buy anything. All you got to do is not eat. And not eating is the only guaranteed way to lose weight. Now, how does it work? Intermittent fasting there's a lot of different versions of it out there, but the simplest version that you can get a lot of benefit from, and this is what I practice myself, is 16-hour fast, several days a week, at least 4 days a week. If you want to, just for general health, 16-hour fast, 4 days a week. If you want to lose weight, you can fast longer, meaning instead of 16 hours, you can try 18, 20 hours, working your way up like that, or doing it for more days. But that's a whole other topic. That's it, 16-hour fast. What does that mean? That means that, for example, your first meal would be at 12 o'clock, and your last meal would be at 8 o'clock, okay, 8 p.m. So you have an 8-hour feeding window. Prior to the beginning of that, you don't eat. No calories come into your body before that period. So if you have coffee, you got black coffee. There's no creamer, no sugar in the coffee, okay? You can have 50 calories, but it gets kind of tight if you have too much. It can shut the fasting mechanism down and you don't get the same benefit. So I just say, play it safe, no calories, okay? So if you have coffee, black coffee. You have tea, no sweetener, just no calories at all. Tea is fine, coffee is fine, before your feeding window begins. And then you eat normally in that 8-hour window, and then come 8 o'clock or whatever time you decided is going to be your 8-hour window, you have your last meal, and you don't eat again until the next day. And so that is kind of intermittent fasting in a nutshell. Now, for overall health, many biomarkers of health can change for the better from fasting. So blood sugar goes down, insulin resistance goes down, blood pressure can go down, cholesterol, triglycerides can go down. And when it comes to cancer, intermittent fasting, because it also reduces inflammation, it can help with reducing inflammation, which can be a contributory factor to cancer. And then the process of allowing the immune system to go and do its job and sort of kill, eat up cancer cells. The word for this is autophagy or autophagy, where there's an automatic eating process where cells in the body, the immune cells will target cancer cells and eat them. That autophagy process is heightened when you're not eating. Okay, so your body sort of goes out and scavenges because your cells still need energy, and they're going to go out and scavenge. They're going to eat your fat cells, which is what we want them to do, and then also diseased, damaged cells are going to be targeted. And those, in some cases, those diseased and damaged cells are cancer. So intermittent fasting is very helpful for a number of reasons, and I usually recommend that as one of the single most important lifestyle choices you can make to improve your health in many different ways. So other things that can help, avoiding sugar. Well, this is something that we know sugar is not helpful to us really in any way, aside from comfort. And when it comes to cancer, sugar feeds cancer. Cancer cells love sugar. And so there are some theories out there that radical changes in the diet can starve out cancer. If you get cancer, and in order to prevent it, avoiding sugar certainly minimizing sugar is highly recommended. A clean diet. What I mean by that, and again, there's a lot more information out there from other folks about this, but clean diet basically is just not eating sugar and junk food and foods that create inflammation in the body, foods that have toxins in them. So organic food is more ideal because it has a less toxic burden for the body. Eating locally is good. You know, going to the farmers markets, buying food from the farmers that are here in this area can be helpful. So eating clean. If you eat meat, it's even more important for the meat to be clean because toxins tend to accumulate up the food chain. So you have a big animal in the ocean. Tuna is one of the most polluted foods. Salmon can be very polluted because they're bigger fish and they eat smaller fish. And so they eat all the toxins that the smaller fish have eaten and it bioaccumulates further up. Cows are big. If they're eating a lot of toxic stuff, it's going to accumulate in their meat and in their bones. So clean diet is important. And then detox, regularly detoxing your body, having certain mechanisms in place to remove toxins from the body. I think probably one of this talk is living in the United States. Our country is very polluted. And we've had, 40, 50 years of weakening of any effort, any attempt to keep the water and the air and the food clean. And there's sort of perspectives that allow big companies here to do whatever they want, and they can put whatever they want into something, and it's assumed safe. And so, these are things they can't do in many other countries because they have rules against it. And outside of California, most states let companies do what they want. And so regardless, as a result of that, a lot of toxins are out there. There's a need to detoxify the body. So that's an important thing. And then, detoxifying the mind, the spirit, the heart through forgiveness. Forgiveness is a good antidote for some of the cancerous emotions and, hatred, anger, resentment. These are emotions that can fester and can be very detrimental to our health. And there is a mind-body connection. And so, working toward letting go of these kinds of emotions and healing emotionally, and it can be very, very beneficial to your sense of well-being. And then also, I would suggest that from the standpoint of preventing cancer, forgiveness is also essential. So those are just a couple of things that I think are important. And if you have questions, because we're not talking in depth about them, please feel free to email me and I'll be happy to discuss them more at length. So herbal medicine. So this is one of the other branches of Chinese medicine. And herbal medicine involves individualized formulas. So the way the herbs are kind of used here in the United States, like sort of the American herbal tradition, not usually formulas, it's single herbs and different combinations of singles. But in China and other similar systems in India and Tibet and places like that in Asia, they had formulas where they had a formula that was passed down for a long time and was found to have a number of benefits based upon a patient's constitution. And so that is kind of how they work. What we offer in our practice, and different folks have different things out there, but capsules tend to be pretty popular. And then also there are granules where it's a powder, you mix it up in a tea and basically warm water and drink it. And that's how you get your dose of herbs. And the herbal medicine helps in a number of ways when it comes to oncology. For boosting the vital energy of the body to support immune function, and also increasing the vitality to treat fatigue. So that fatigue part is a big part of the herbal treatments. And then also improving digestive function. So digestive function can be sometimes impaired by oncology treatments and acupuncture. The herbal medicine can help to support that. So those are a couple of the benefits of herbal medicine for oncology. In terms of acupuncture treatment, most treatments last about an hour. The pins are left in, sometimes we do a front and back treatment, and the pins are left in. We offer front treatments. We also offer front and back together. And few folks will describe it as painful, and size matters. So there's a hypodermic needle on the left side, and then we have acupuncture pins on the right side. And the hypodermic needle is, I'll tell you a story briefly. So when about 10, 12 years back, when I was first getting started with acupuncture, I worked in a drug and alcohol detox facility, working with folks that were in recovery primarily from opiates. And I walked in the first day and we're doing acupuncture to help them with their cravings and anxiety and insomnia and withdrawals. And I walked in the first day, there's a group of folks sitting in a circle, about 15 people. And I said, hey, my name is Esley. I'm gonna come around and put some needles in your ear for the treatment. It was a protocol of points on the ear. And one gentleman jumped up and said, he said, what do you mean needles? He said, we are IV drug users. You're gonna trigger us to want to use. Let me see this needle. What are you talking about, needle? And so I pulled out one of these little guys about this same size. And I showed it to him. And he said, that is not a needle. He said, that is a pin. A needle is hollow. A needle is for putting something in, taking something out. He said, that is not a needle. He said, don't ever call it that, or no one here at this rehab place is ever going to do acupuncture. And I thought he was a brilliant young man, and I thanked him for his perspective. And ever since then, I have been saying pin instead of needle. So size matters, and folks are often apprehensive about the size of the acupuncture pins. The acupuncture pin does not feel at all like getting a shot. If you got your COVID vaccine, it does not feel like that at all. Size matters. Acupuncture treatment, here's a baby getting acupuncture. Does not appear to be in any kind of distress. So that's an idea of how the treatment feels. And let's get into mushrooms a little bit. Medicinal mushrooms have been used around the world for thousands of years. And they are an important part of Chinese medicine. And they are growing in popularity now for food and for medicine. And this is a good thing, because the mushrooms really have some amazing benefits. In this picture, these are some what they call pink. Really, it's more kind of an orangish color, but they're pink oysters. And these they're actually pretty. They grow around here, and this is actually, if you look at the bottom, that appears to have grown on a substrate. So someone grew this one on their own. So these are some of the benefits that mushrooms have for oncology. Stimulating, engaging the immune system to fight cancer. They can actually enhance the effectiveness of chemotherapy. They definitely mitigate the side effects of chemo and radiation. And then many mushrooms have anti-cancer and anti-tumor properties. So protecting against damage from radiation and protecting the bone marrow. One of the concerns of radiation is damage to the bone marrow. So mushrooms may help with that. Increasing vitality, just like Chinese herbs, so mushrooms can help increase vitality to address fatigue and improving longevity and life expectancy for folks who have cancer. They may slow tumor growth and downregulate tumor genes, and also trigger cancer cell death. So one of the effects that mushrooms have in, excuse me, one of the effects that they have is actually changing genes. So they can turn anti-cancer genes on and turn cancer genes off. So when we say downregulate, they're turning off those cancer genes. And there is a normal process of, I believe the word is apoptosis, where cells die, cancer cells die. And mushrooms can help sort of flip the switch inside of cancer cells and tell them to turn off and pass away. Turkey tail mushroom is the first one we'll talk about. This one grows widely all over the world. It grows in this area. You may have seen it in the woods. A lot of times mushrooms, if you get out in the woods around here, or really anywhere, mushrooms are all around us. We don't always see them. And not every mushroom you see is edible. That said, they're all over the place, and mushrooms are sort of one of nature's ways of garbage disposal. So breaking down dead, diseased, or not diseased, but dead and decaying plant material. And so turkey tail grows on certain types of wood, and it looks like it's called as turkey tail. It looks like the tail of a turkey. And this is a pretty fresh sort of one here. You can see that the ridge of the outer ridge, the white, is pretty bright. So turkey tail is very beneficial when it comes to oncology. There's been some research, and if you notice at the bottom, I've got the citation there. So if you don't look any of this up, you can look up the citations on the bottom. But increased survival rates with the use of turkey tail for breast and gastrointestinal cancers. And what that means is a 9% reduction in the 5-year mortality rate. So one of the ways that they track certain types of cancer is how many folks have died after 5 years of being diagnosed with that cancer. And one of the studies with turkey tail found a 9% reduction. That's pretty good, 9% reduction in that mortality rate. And turkey tail was also shown to inhibit tumor growth. Now, turkey tail is not a culinary mushroom, okay? It's not like an oyster mushroom or a shiitake. Turkey tail is very hard, very fibrous. You can't really bite it and even chew it. We'll talk about how to take mushrooms later, but this let me emphasize, this is not one you're gonna be putting into food. So reishi is also like turkey tail in that respect. Reishi is one of the very famous mushrooms, and actually this picture here is some reishi that I found in Mount Washington, Stanberry Park, and I've seen reishi all over the place here in Cincinnati. And you can see the white on the outer border there. That white, the brighter it is, the fresher it is. So reishi is often called the immortality mushroom, and it's a mushroom that's been the word reishi is Japanese, and there's in Japan and in China they've really talked about this mushroom and its benefits for calming the spirit, as an aid for meditation for folks that are into that. And as a mushroom that is very, very beneficial for health. And so when it comes to oncology, one of the compounds in reishi, one of the beta glucans isolated from it, may help with side effects of radiation and prolonging life, so increasing the longevity of folks with a cancer diagnosis and reducing bone marrow damage from conventional therapies. A combination of reishi and turkey tail can be effective to mitigate the side effects of chemo. Chemotherapy works by cytotoxicity. It kills rapidly dividing cancer cells. But the problem with cytotoxicity is that it can't, for the most part, really can't distinguish between cancer and non-cancer. And so chemotherapy is also harmful to healthy cells. And so there's that sort of saying that we want to kill cancer before chemo kills you. And so when it comes to cytotoxicity, reishi and turkey tail together may help to minimize some of the negative effects of that. So that the cancer is able to go and target, so that the chemo can target the cancer and damage the body less. And in doing so, the reishi and turkey tail may actually make those cytotoxic chemo drugs work better. So the drug works better, less side effects. So therefore, improving the quality of life for the patients going through those therapies. This is called Maitake, and this is a culinary mushroom. It also grows around here in this area, usually at the foot of oak trees. It's also in this area called hen of the woods. And I have not found this. I found it, I didn't know what it was until later. So, but it's out there, and it's tasty. Let me just say, I'm talking about mushrooms from my experience as someone who likes to go out and find them. I don't necessarily recommend that folks do that. If you have an interest in that, we could talk more about it. It can be safe to do if you know what you're doing. But I'm just sharing that because I love mushrooms and I think that they're very, very beneficial, but there are much easier ways to take them than going out and looking for them in the woods. And we'll get into that momentarily. Combining Maitake and turkey tail for treating colon cancer, polysaccharide-rich extracts from both of them have been shown to inhibit tumor cell proliferation and cellular growth. So slowing down how quickly a tumor can grow is what, at least for colon cancer, is what this study showed for these two mushrooms. Also, inhibiting cancer cell migration and invasion. So limiting the potential for those cancer cells to metastasize and spread and go somewhere else in the body. So basically these mushrooms are helping to keep that cancer cell contained. Oyster mushrooms also grow around here, and they are quite delicious to eat. They are anti-inflammatory and contain antioxidants, which can help with cancer treatment. With cancer, just dealing with cancer in general. Oyster mushrooms may inhibit the growth of colon and breast cancer cells. So there are a few ways to take mushrooms. There's a book, there's a movie that came out within the last couple of years called Fantastic Fungi. And it was on Netflix for a while. It may still be there. If you're interested in mushrooms, it's worth checking out. A fellow named Paul Stamets. It's sort of about him a little bit and some of his theories on mushrooms. He's sort of a main character in it, but it's really about the whole world of mushrooms, and it's entertaining. I recommend it highly if you want to learn more. And Paul Stamets has a company called Host Defense, and Host Defense makes some pretty good mushroom products. One that I like in particular is a spray. They have a few that are in spray form, so it's pretty easy to take. I carry that one in my office. I like it that much. And so all the Host Defense products, they're widely available online. They're worth checking out. And then the next one, Nourishing Nutrients, is another great company. They make a mushroom powder. Okay, this is an excellent way to take pretty much every mushroom that we talked about today, and some other ones are in their powder. And you can put a teaspoon in coffee or smoothie, or just take it straight. And it is a powder that's extracted in a way that maintains and preserves a lot of the, as much as possible, of the active ingredients and the potency of the mushrooms. And so you can get that off of Amazon or on the website of Nourishing Nutrients. You can order from them there. Like 4 ounces is like maybe 20, 25 bucks. So it's a great product that I recommend. I take regularly myself. And then the last item here is Rich Life Farm. And they're a couple of young folks here in Cincinnati. And they have a farm out somewhere on the east side where they grow mushrooms. And so they're around at farmers markets, and you can pick up edible mushrooms from them. They have oyster and lion's mane. We didn't talk about lion's mane, but lion's mane is another popular mushroom out there. So Rich Life Farm is worth checking out. You can get a pound of really gourmet quality mushrooms for about $15. So it's worth checking out. It's tasty and very good for you. So those are a couple of the ways to take mushrooms. Again, foraging, is something you can learn how to do, but these are other ways to get things in a more standardized dosage. So that's all we got for tonight. Are there any questions? You can feel free to type your question in, or just you can unmute yourself and ask. Let me share one book that I wanted to mention, called The Cancer Killers. And it's by Charles Majors and a couple other guys. If you just search for Charles Majors, you can find it. This is one of the best books on cancer. It's not super long, but it's got a lot of information packed into it to talk about different, it's a whole very unique perspective on cancer, but it can be, it has some helpful information in there. So I recommend that book. It can be sometimes hard to find out there. So if you just remember it and then check again in a few weeks, if you can't find it, sometimes it's at a ridiculously high price because it may be out of print from time to time. But if you look various points over the course of a month, it may pop up on Amazon or other places. And let's see the question. Yes, Miss Pitts, how you doing? Long time no see. Do we carry any of those products? We don't carry, we carry one, yes ma'am. We carry the host defense product. There's an immune spray that I like a lot. We carry that. Nourishing nutrients, we don't carry. I've tried, I would love to carry it because it's a fantastic product, but I just send folks to nourishingnutrients.com or to Amazon, and you can order it there. But yeah, when I talked to them a while back, they didn't really, they weren't interested in doing wholesale sort of stuff with providers. So, but you know what, you're asking, and I'm going to have to give them a call again and see if they've changed their perspective on that. But that, the Nourishing Nutrients, that is one that I take myself almost every day, and I find that it gives me a little pep in my step. I get a little extra sort of energy boost from it. So I like that. And you are welcome. All righty, folks. Any other questions? Okay. Question about acupuncture during chemo cycle. that's a good question, and it probably will vary for each person. It really depends on how you're feeling, or how the person who is going through chemo is feeling. So because sometimes you're just too wiped out to go and do anything. If you can get in twice a week, even leading up to getting chemo, that can be helpful to kind of get a little extra boost before it starts. That can be helpful, and then once or twice during that cycle. So it all depends. But for that kind of question, that's just give us a call, and we can, or send me an email, and we could talk more about that. And our email is right here. All right, folks. Well, those are some good questions. If anything else comes up, please feel free to reach out, and have a wonderful rest of your evening. And thank you for listening.